Welcome back to the Now Morning Show, 20 minutes past the hour of 6 o'clock, and we are shining a spotlight on survivorship.
This morning, we take a step into understanding survivorship and the quality of life of cancer patients. To do so, I want to welcome Dr. Agatha Carrington, medical sociologist and health systems specialist. Good morning to you, Dr. Carrington.
Good morning to you, Rocus.
How are you this morning?
Not bad at all. And good morning to Tobago, and good morning to Trinidad and Tobago.
And thank you so much for... Thank you so much for joining us this morning. Let me say, firstly, congratulations on the book. You launched a brand new book, Understanding Survivorship, yeah?
Yes, survivorship and the quality of life of cancer patients, more specifically.
All right. Tell me what firstly inspired you to decide to put all this information together in the form of a book?
Okay. So having had the opportunity to study a cohort of cancer patients attending the then National Radiotherapy Center in St. James, ending with the award of a PhD from the University of West Indies 10 years ago. And prior to that, I had 7 years of study with those patients. I felt I had to add to the body of knowledge that is available to cancer patients and other professionals. I felt that was an important contribution. And then also, that because the number of survivors are increasing, it meant we had to understand much more the continuum of care, what's required to manage these large numbers of survivors, because we have to manage them from diagnosis to end of life, addressing all those issues on the continuum, be they symptom distress, be they treatment and care issues, side effects, and so on, right until the end of care. So that I felt I had to just do that. And also the impact that survivorship has on the health system and even on the patients themselves. And so those three issues I felt were enough triggers to have me write this book, because I think this book will provide hope to patients, their families, some of my colleagues. I just felt that will be a useful contribution.
I have no doubt about that at all. Tell me, what accounts you think for the growing number of survivors that you mentioned?
All right. So one, persons are living longer. We have more new cases, larger number of new cases, both in the developed countries and the underdeveloped or developing and or low-income countries. And so you have more new cases, and if you would permit, let me just look at what is happening in developed countries. Now, developed countries like the USA, even though we can say that there's improved access, there is early diagnosis, and the most part treatment and care is available, you have persons living longer. So that's one reason. So a large number of new cases. Yes, you have deaths, but you also have a growing number of persons surviving because of the improvement in treatment and care. So it's the same thing with our country as well. In Latin America and the Caribbean, it is much the same. And therefore, if you have this growing number of persons and persons living longer, you have to design services and provide the support and care they require as they go through this, what I may call a journey. Because survivorship is from diagnosis all the way to end of life. And
Right.
so this is an issue that we must confront and treat with, because it is one of those public health concerns. Cancer is a public health concern, and therefore we must treat with it.
Yeah. Dr. Carrington, tell me about the challenges that the survivors face, especially when it comes to the healthcare system as well.
All right, so as a survivor, assuming that you are the breadwinner, you will have challenges like economic challenges. So issues around work, earning income if the side effects are such that you are unable to work and you lose income. So that's one. There has been improvement in terms of access, and we have in country several facilities available to cancer patients. But that there's a need to coordinate the care, and so that all the elements must be in place. Yes, there's improvement in infrastructure, so we now have the medical equipment required for the treatment and meds for the care. But we still require coordinating matters with respect to medical social work, matters with respect to needing assignment of or involvement of nutritionists in the management of the patient. So you have some of those that are happening. Access will still be an issue because of the numbers of persons. How you coordinate the care would still be an issue. And of course, with the growing number, the treatment arrangements must be looked at such that persons are able to get the care as and when required. Of course, matters with respect to access to medication. I had the opportunity when I launched at the treatment center where a patient indicated the challenges with respect to not having the medication that she requires on a continuous basis, such that that's from within the system.
Right.
And therefore, she had to procure that outside at her own cost. So these are some of the challenges that they would face within the system. But there are other challenges that the survivor will face, which are internal to their own home and so on. Family support is important for a survivor because cancer is not a disease just for the survivor. It is a disease of the family. And when a cancer survivor, you are in the family is affected. Mm-hmm. And so the extent to which there is what we call social support, that contributes to the improvement in the quality of life. When that is absent, that is a challenge as well. In some families, their teenage children, they may not embrace this whole matter of a cancer survivor living in and requiring the kind of support. And it may not be to the extent that it should be provided. So there are several areas that must be considered.
And you cover all these areas. You cover all these areas in the book. Tell me where we can get access to copies of the book.
All right. So the book is already uploaded on Amazon. It is as an ebook as well as a soft copy, paperback. Nice. It is available online. The US $18.95 the cost for the paperback online. Copies are also available if I am contacted at my own number. If I may share my number, it's 688-0888. Copies are also available for persons who require them as well.
688-0888?
Yes.
All right, fantastic. So before we wrap up this morning, Dr. Carrington, can you give a message of hope to survivors and their families?
Of course. The book is about a message of hope as well, because it provides, and the way it's organized, it speaks about, in one section, it addresses cancer, quality of life, and survivorship. So when you, for instance, post-treatment, or even when you have your diagnosis, those domains that must be looked at, be they psychological, physical, functional, it sets out in a structured way. So I have set, for instance, some anecdotes from patients that I would have spoken to and met during this work. And I use the anecdote and then point to what the evidence says. So there's evidence to support what happens post-treatment, and that you can look at that and understand what is happening. And then there are recommendations and then a call to action. So the hope that I'm giving you is that you can look and see if this is what I am experiencing, what are the recommendations, and what, in the case of the actions, what should happen. So there are actions to be taken at the individual level, and there are actions to be taken at the systemic level where the health system must provide the kind of support required. And it speaks strongly about how you survive, how you navigate this on this journey, because once you have started, you are in survivorship. It is not that survivorship ends even when you're treated, because you have to go through periods of acute survivorship at the startup. You may have what we call extended survivorship and then permanent survivorship. So this goes all the way to the end. And what this book sets out is a way for you to look at and understand how you can navigate the journey, because there's evidence, research done in each area to explain what is happening. What is happening when you have prostate cancer? What is the evidence saying post-treatment for whatever side effects you are experiencing? And so it allows you to have a reference point on this journey, this survivorship journey. So
Fantastic.
that's the message I want to share.
Well, fantastic. Thank you so much for joining us this morning, and thank you for sharing that message, and thank you for contributing this book so that survivors have a better understanding, the families have a better understanding, and hopefully the health systems can also be improved. Thank you for joining us this morning, Dr. Carrington.
Thank you for having me.
Not a problem. Enjoy the rest of your day. Survivorship and the Quality of Life of Cancer Patients. The book is available on Amazon. You can call Dr. Carrington directly at 688-0888 to get your copy of the book. We take a quick break and we come back with more on the Now Morning Show. Stick around.